We have investigative protocols for studying a number of different maladies and conditions, including autoimmune, arthritis, neurologic disease, urologic disease, orthopedics disease. And very often the question comes up, how can the same stem cells treat so many different things? How can you have the same cells that treat lung disease but also treat cardiac disease and knee arthritis? And it's only really a conceptual problem if you think of cells as a drug, because you'd wonder, well, how can one drug be perfect for everything? But if you really understand live cellular therapy and the fundamentals of how our repair system works, it really makes sense, because we have the same stem cells floating around our bodies from our bone marrow that go anywhere there's damage and basically affect repair. So we don't always have to have a different stem cell for every single condition. So if we're looking at mitigating degenerative, inflammatory, or traumatic conditions, it really actually makes sense that we might use the same cells. Now, the key is what happens when the cells interact with the damage and that damaged milieu. The cells change and they activate and they respond appropriately. Sometimes they'll make cartilage, sometimes they'll make blood vessels and nerves, sometimes they'll make retinal tissue. So it depends on what tissue they're interacting with and what they're reading as a damage signal. The primitive cells that we have in our stromal-vascular fraction, which is the part of your fat that doesn't have any fat, it just has the cellular portion. It's very rich in mesenchymal stem cells, and there's a lot of other cells in it also. There's some immune regulatory cells, white cells, red cells. There's many different types of cells, but particularly the mesenchymal stem cells, or that we also call adult mesenchymal stem cells. Those cells respond to damage and change, and they are capable of fixing anything. So we've found that adult mesenchymal stem cells from the soft tissue surrounding fat and the blood vessels that are interspersed in the fat, those cells can form any kind of tissue you can imagine. They can form nerve, they can form blood vessel, they can form many things. It just depends on the signal that they're reading, and it's an on-demand system. So they're smart. They're smarter than we are, and they figure out what needs to be done to affect repair, and they do that naturally.